as more people sign on. I want to thank you all for participating in our 2021 Virtual Homeless Awareness Conference. My name is Laura Thielen, and I'll be moderating this discussion. And this will be a discussion. It will not be just a talk from Katie. It will be a lot of interaction. So looking forward to seeing all you folks. Looks like we've got quite a few folks now, so we're going to go ahead and get started. All right, welcome to the final session of today's Homeless Awareness Conference. Today we will be talking with Katie Miller. My name is Laura Thielen, and I'm the Executive Director of Partners in Care, and I welcome you all to our final session. Just a reminder, if you can put your name in the chat, that will really help Katie make sure that she gets everybody's comments. And this will be a talk story session. So Katie Miller is on the National Initiative team at the United States Interagency Council on Homelessness, otherwise known as USICH. She works across the Western US with states and communities to implement best practice solutions to prevent and end homelessness. She works with local leaders to bridge efforts happening on the ground to the policy work that is taking place in Washington, D.C. through the Council's 19 federal member agencies. Katie is based in Seattle, Washington, and has worked to design and implement innovative solutions to homelessness for more than 2 decades. This session will be a listening and discussion session that we invite you all to take part in. If you wish to make a comment or post a question, you can put it in the question area or simply use the raised hand icon, and I will recognize you and you can unmute yourself. This is your opportunity to share your thoughts and ideas with our representative from the U.S. Interagency Council on Homelessness. And with that, I will turn it over to Katie.
Great, thanks, Laura. It's great to be with you all today and close out your great conference. I'm going to be brief. I'm going to go through a set of slides to give you some context related to USICH and our federal plan, and then I really want to get to the part of the session where I hear from you. So, Laura, you can go to the next slide. In the chat, if you'll write your name, your role, your agency program, and the community that you work with, that would help us a lot. We're going to be documenting all of this. We at USICH, the United States Interagency Council on Homelessness, we're a very small federal agency, but we have a large impact. We coordinate 19 federal agencies at the highest level, at the cabinet level in Washington, D.C. Our job is to coordinate those efforts among the 19 agencies. So from HUD, HHS, the VA, labor, all the way to the post office. And that work is coordinated through a federal plan to prevent and end homelessness. We also create partnerships at the local, state, and federal level. And my job is, as your regional coordinator, is really to bridge what's happening on the ground with what's happening in Washington, D.C. at the policy level. I'm based in Seattle, Washington, but I've been working with Hawaii for a number of years. I also just wanted to put out there as we get into this session that the United States Interagency Council on Homelessness believes that housing should be a right and not a privilege. Next slide. Great. So as Laura mentioned, we are creating a new federal plan, and there's some core values that I wanted to share with you as we set into this work. We intend for this new plan to center racial equity, support evidence-based best practices such as housing first. We want this plan to sustain and build on what's working. We want it to reflect on evolving practices and lessons learned from the pandemic, and identify opportunities to address areas of greater need and attention, and be sure that we're aligning strategies at the federal, state, and local level. We find that when we can align this work, we can make greater gains. Just to give you a little history about USICH and our federal strategic plans, in 2009, the HEART Act directed USICH to submit a national strategic plan to end homelessness and to update it regularly. Our first ever federal plan came out in 2010, and it was amended in 2012 and in 2015. We created a new plan called Home Together in July of 2018. There was also a plan that came out very briefly in October of 2020, but it was immediately discontinued. And so currently we are operating without a federal plan, and that is why there is an urgency to get this new plan written. And next slide. So to give you a little bit of information about the previous plans, Opening Doors, as the first plan really set the stage for coordinating and aligning the federal agencies. So it really had, its context was based on being sure that the federal agencies were aligned and working together. It had some key broad themes like leadership and collaboration, access to stable and affordable housing, economic security, improving health and stability, and retooling the crisis response system. If you remember, this plan, it also had key dates. We're going to end veteran homelessness by X date. We're going to end chronic homelessness by another date, family homelessness, youth homelessness by a certain date. That was the context for Opening Doors. And then with Home Together, we heard very clearly through our input from communities that those subpopulation goals and those target dates were difficult because it didn't always align with the local context, either the resources that were happening on the ground or the priorities that were being driven at the local level. And so while we still had increased areas of focus like affordable housing, prevention and diversion, unsheltered homelessness, rural homelessness, employment, and learning from people with lived experience of homelessness, and we also had subpopulation goals, we didn't dictate specific subpopulations that communities needed to focus on first. And we didn't say that it had to be done by a certain date. We allowed communities to set those aggressive goals at the local level. But all of this was based on creating a path or creating a roadmap for communities to ensure that homelessness was rare, brief, and one time, that communities had the systems in place to measure and guide their work with data to ensure that people were moving quickly to permanent housing. Next slide. So we've made some gains since our first ever plan. We've seen, especially around veteran homelessness, we've seen veteran homelessness drop 50% nationally since 2010. And I'll say that the biggest reason for that is because of the funding that has come from the federal government through VASH and SSVF, also the alignment with services attached to housing, which we have seen in veteran homelessness. We have not seen the exact same level of commitment or funding at the federal level for the other populations. We have, though, made some progress on family homelessness and youth homelessness, and brought overall homelessness down a little bit. But since 2016, it has really become static. And so we are not seeing decreases in homelessness. In fact, in some areas, we're seeing rises. We're particularly concerned about the rises in chronic homelessness, and we're very concerned about the rises in unsheltered homelessness. Next slide. This slide is pre-pandemic, and just want to point out a few things that the blue line is all people experiencing homelessness, the gray line is sheltered, people who are sheltered, and the green line is people who are living unsheltered. Our latest data on those experiencing unsheltered homelessness is that the numbers of individuals experiencing unsheltered homelessness is now higher than the number of individuals experiencing sheltered homelessness. And this data point is very alarming to us. Next slide. So we know what it takes to end homelessness. You all have done this hard work. You know what it takes to end homelessness. It takes alignment and ambitious goals, committed leadership at the highest level that really drives action and brings everyone together. The availability of dedicated resources, this housing first approach, which is not housing only. It means that we move people as quickly to permanent housing, but we provide the support services that they need to stabilize and move on with their lives. Also, it takes a very clear vision and framework, and we have created the criteria and benchmarks for ending veteran homelessness, chronic homelessness, family homelessness, and youth homelessness. What that is really is, as I mentioned, a roadmap for communities to measure the benchmarks and criteria and measure their success on creating a system that prevents homelessness whenever possible, but when it can't be prevented, that it's a very rare, a brief, and a one-time experience. And so it's moving people through a system, and you're able to track that data very carefully and measure your success towards that work. And so that vision really has made a difference in our work, especially on veteran homelessness. In communities before the pandemic, we're really building those systems and translating that work to other populations. Next slide. So where do we go from here? And since our last change, or since our last plan, our world has changed. The impacts of the pandemic have really highlighted the critical link between housing and health. We have a growing crisis of unsheltered homelessness, as I mentioned, and it has never been more clear the impacts of racial injustice and inequities and how they disproportionately affect the housing and health outcomes of people of color and vulnerable populations. On the other hand, we have a $1.9 trillion resource through the American Rescue Plan. We also have the CARES Act money, a lot of resources within the American Rescue Plan that are dedicated to addressing homelessness that we have to leverage and maximize. This once in a generation opportunity to have these resources available to us, we have to really use them well, and hopefully get additional resources through this administration and through Congress to continue our work and make progress on addressing homelessness. Next slide. So I'm going to stop talking at this point, and I am going to open it up for questions. There are 6 questions that I'm going to go through. 5 of them are just general questions, and then the 6th one is sort of a full, opening it up for any questions that you have or any comments or statements that you feel like didn't come up through the earlier questions. So the first question is, what should the federal government's top priorities be as they relate to preventing and ending homelessness?
Okay, so folks can raise their hand or unmute themselves or write a comment in the chat or the question section.
Hi guys, this is Josh, the admin. Most of those functions are not going to work with the web portal. So if you go right underneath the web portal, it's going to say connect directly to the webinar platform. And if you want to, you can click that button. It will bring you into Zoom directly, so you can use the raise hand function as well.
Great. Thank you, Josh.
And Josh, will folks just be able to unmute themselves and just speak up?
They should be able to unmute themselves and be able to talk on the web platform, but they won't be able to raise hand unless they join Zoom directly.
Okay.
Okay, so far we've got from Betty Lou Larson, we've got new affordable rentals are #1, then Section 8 or shallow subsidies like with vets. From Samantha Pons, we have mental health resources. From Alex De Leo, we have raising the minimum wage, controlling housing costs. From Frederick Constantino, providing affordable housing that is actually affordable. From Susie Tam, affordable housing. From Donna Lay, funding to provide mental health and housing resources. From Soon Kim, increase housing supply and criminal justice reform, decriminalize drugs. From Gina Hurt, true affordable low-income rent limits, $1,700 for a 1-bedroom is not affordable. Any other comments from anyone? think we're seeing a trend here, Katie, with the affordable, truly affordable housing. From Maria Grams, we have low income housing, raising the minimum wage, and treatment for mental health and substance use disorder readily available. From Ann Chomness, stop developers building places no one can afford. From Whitney Young, the decommodification of housing. From Kavahine Bukosa, semi-independent group housing for adults with mental health and other issues. From Jessica Sintos, more accessible and affordable housing is needed. From Betty Lou, agree with truly affordable rentals with states trying to stretch their housing dollars, rents are going up. Raymond Sebastian, stringent accountability measures for all key players. Go after those whom are identified abusing the houseless population. From Cabero, lessen the background check to allow individuals with criminal background to obtain housing. From Katie Langgraf, outreach, understanding successful steps from those working directly with the homeless and implementing these steps into current programs. Also, holding homeless programs accountable for more than just having a quaint. So I think that touches with folks who are homeless. From George Nebea, can federal implement rental control? From Tiari Akana, rent affordable to someone's income. If you only have SSDI, how can you really afford anywhere in Hawaii other than an SRO? From Melissa Cabales, I agree with rental control if that's possible. From Cassiopeia Yamashita, rent amount caps and enforcement. From Melissa Altura, there we go. Oh, that's just reporting who it is. From Anne Shaughness, require Hawaii politicians to work with the community. And let's see, and Tani Kalahiki, stop building affordable housing. It's not affordable. We need more low-income housing. And from Women in Need, easier application process.
Great.
And from Cheryl Belisario, help states to better use federal housing resources such as Section 8 HCVs because so many landlords don't want to accept the vouchers. The process also needs to be streamlined. And from Vicki Buneo, are there any monies to build affordable housing?
Excellent.
That's
Why don't
it
we
for
move
now.
on to the next question?
Okay.
I like the last statement, though, adjust what it means to qualify for low-income housing.
Yeah.
So the next question is, what are the biggest barriers to ending homelessness in the communities your agency organization serves, where you're located?
Lack of pet-friendly housing. That's from Susie at the Hawaiian Humane Society. From Mallory, oh, she was on the last one. From Bob Wardlaw, treat housing as a public utility. Juliana Caldwell, low wages, high cost of living. From Tasha, more affordable housing for single working class. From Erica O'Brien, criminal background checks. From Melissa Cabales, criminal records, mental health issues. From Maria Grams, ridiculously high cost of living, low minimum wage, and inadequate mental health substance use disorder treatment. From Josh, lack of housing that families can afford. From Samantha Pons, ending generational return. From Tani Kalahiki, not enough low-income housing for elderly on a fixed income. From Women in Need, landlord education on the HUD process. From Cabero, landlords or realtors not accepting subsidy housing vouchers. From Morgan, homeless folks being displaced by police sweeps. Hard to find our clients in order to connect them with services. From Melissa Cabales, cost of living being astronomical. From Ann Shamness, not enough people to give intensive services. From Gina Hurt, IDs, etc. for children in the household should only need adult documents. From Nicole Fries, mental health, substance abuse, income caps to qualify for vouchers, not enough vouchers available. From Haunani Reed, criminal records, mental illness. From Jacqueline McCoy, high cost of living, long wait lists for subsidized housing, inadequate wraparound services for housing first programs to connect clients to once housed. From Florence, cost of living in Hawaii versus individuals' income. From Vicki, limited income and high costs. Susie Tam, agree with sweeps, everyone disappears. From Maria, need to find a way to help those with severe mental illnesses, substance use disorders who refuse treatment. From Sam Church, high cost of living and not enough affordable housing. No, skip through some of these that might be repeats. Unrealistic conditions, no pets, need to be sober, no supply in urban Honolulu, lack of ID and poor credit scores. From Rian, need more case management to help with housing retention and to prevent evictions. Limited housing, absolutely no low income that accepts Section 8. The stigmatization of houseless families and individuals. All the red tape and gaps to help those who have severe mental illnesses. And very hard to assist those experiencing SMI and substance abuse with ACLU decisions, civil rights laws, etc., especially when those who suffer cannot always make the best decisions. We need more assisted community treatment accessibility. And most of these are pretty much the same: income and lack of affordable housing, background checks, and lack of services related to mental health and substance abuse.
Great, let's go on then to the next question. So we have enough time. How can the federal government more effectively center racial equity in its prevention of or response to homelessness? And how can it best support equitable distribution of and access to resources and equitable outcomes at the local level?
This is a long question, so it'll take a while for some to trickle in. Stop criminalizing mental illness. Ask the community directly, go out there. Invest in marginalized communities to try to decrease chance of homelessness. Decriminalize drugs. Work with grassroots organizations that are connected to community versus only working with large organizations. Give them the help that they actually need. Language access. Have oversight measures if programs are implemented via the state. More community-based involvement. By changing education requirements through K through 12 so that accurate history, redlining, steering, etc. is taught to everyone in the country so that people are aware of what barriers they may face and how to avoid ending up there in the first place. The answer is so much more than we can quickly say, but I think it requires a large change. Things such as CRT, reparations, funding for our vulnerable populations, taking care of our vulnerable communities, etc., are necessary. more outreach to minorities, cultural competency, giving land back, and reparations. Racial disparities show up the most in poverty and the criminal justice system. Federal government can give more land to OHA, which is the Office of Hawaiian Affairs, and DHHL, Department of Hawaiian Homeland, to increase supply for Kanaka. Most of the available land here is occupied by the military. Again, decriminalize all drug use. Hawaii still uses cash bail, which can lead to homelessness. More people of color with lived experience working with houseless individuals. More wraparound services needed to rehabilitate individuals into the community for stabilization. More evenly distributed housing project areas. Economic status inequality usually leads to segregation, so move housing projects to areas that would allow for more diversity. Was there proportional racial diversity among the homeless veterans that benefited from the federal dollars put into housing veterans? If white veterans were housed at greater rates compared to houseless populations, then you have the answer. Subsidized housing that has requirements for diversity and blended communities. Make mental health care more accessible. Community navigators hired by the county to work with minority populations to help them get the necessary documents needed, as well as apply for housing. And then looking at data to ensure those who are receiving services are in line with data on those who are overrepresented in point in time and other counts. More focus on funding affordable housing for the extremely low income. And the success of the SSVF program shows that providing funding without stringent requirements on families, like penalizing people for increasing their income, works. The amount of money dumped into the VA program is working. However, the majority of vets, up until very recently, are white males. This amount of funding needs to be given to Native and local communities.
Great, thank you for that. Let's head on to number 4.
Okay.
So this next question is, what lessons have you learned during the COVID-19 pandemic about how the housing, health, and supportive services systems can best respond to people experiencing homelessness?
Great question. And one last response to the last question was funding new construction with more of a mix of income, not just 5% at 30% of area median income, raised it to 20 or 25%. I'll jump in with my own lesson learned on this one. The fact that during a pandemic, we were able to house so many folks, despite all the COVID restrictions, and outreach continued no matter what. So if we can do it during a pandemic, we should definitely be able to do it at a higher rate without a pandemic. All right, if everyone works together, great things can be done. From Melissa. Bringing services to the streets that has success. Example, COVID testing, vaccines, laundry, meals, etc. From Morgan. Access to internet and phones are a necessary utility in this time. It helps connect people to services via telehealth. I feel like we learned how underfunded and understaffed many of our organizations are. The more funding and people these programs have, the better we can service our community. Response to homelessness should be equal to COVID response. I think the recognition that homelessness is a crisis within a crisis during COVID time. An ounce of prevention is a pound of cure. The state was not ready for the pandemic, especially not the increase in needs. Similarly, not enough measures in place to prevent homelessness for the marginally housed. And increased assistance with landlord engagement and mediation to avoid eviction. Technology hubs and staff are needed. Landlords learned that having a diversified portfolio of tenants with diverse income streams, namely Section 8 vouchers, helped landlords pay their mortgages. And that is from a landlord, Kim Coco. And from Jessica, not looking forward to the next COVID-19.
We can move on to the next one. But first, I just want to recognize and tell you all how grateful I am and acknowledge how hard it has been for everybody over the almost 2 years that we've been going through this. And I know especially for those of you working on the ground with vulnerable populations, it's been a very challenging time. So I'm so grateful for your work. And I recognize that it's been hard.
Yeah. And I'll reiterate what Annie put in the chat. I love how our communities came together to assist.
This next question is really about whether it's helpful to have the federal government set specific dates and targets as you are setting your own targets and goals at the local level and trying to align with what's happening at the federal level. Is it helpful for us to set similar goals, such as ending homelessness for all people or for specific subpopulations? Should there be subpopulation specific goals or just one goal to end all homelessness? And should goals include target dates? Again, this is really trying to get at, as we set a structure and a framework at the federal level, what is the best tool for you locally as you set your own goals and targets?
I'll speak up for my perspective. I always like having a goal in front of me.
Is it helpful to have subpopulation goals or best to just focus on all populations at the same time?
From Erica, we have subpopulation goals help workers become more specialized and able to focus. So I think that's a direct answer to that. Melissa, I think there should be subpopulation goals because the help that is needed may not be the same across the board. I also feel that target dates are good because it adds a sense of urgency. From Sam Church, subpopulation specific goals are helpful. From Martha, I feel there needs to be subpopulation specific goals as not all homeless individuals are the same. From Anne, Native communities may need specialized goals. From Chris Jackson, subpopulation focus helps us be more focused and intentional in our efforts. Would love to see higher priority and resources allocated to prevent early childhood homelessness. From Sam Church, for target dates, I think these need to be set locally based on local resources available. From Rhea, there should be subpopulation goals we have to tailor to their needs. Not everyone deals with the same problem. And from Betty Lou, need subpopulation goals so you can see trends, for example, rising homelessness among elderly or lowering need of some populations. From Julia Wolfson, in terms of CES, subpopulation focus helps us to address specific gaps and avoid people slipping through the cracks. And from Berta, all homelessness should always be the goal, but can seem overwhelming and out of reach sometimes. Subpopulation goals can give providers more specific goals as well as have a sense of success and achievement when reached, boosting morale to tackle the next subpop. From Soon Kim, the goal should be universal. This means the means will differ for different jurisdictions. For example, in Hawaii, high cost of living and lack of supply. Federal should use enumerated powers to stop things that exacerbate homelessness. For example, the city of Honolulu is still conducting sweeps, which also exacerbates the supply chain issue for the residents and is negatively impacting the environment. Should work similar to FEMA, giving local government grants when there's a state of emergency. From Jacqueline, I think that goals should be specific to each person and family, as not everyone needs the same things to be able to heal and reach success. I think that setting dates on smaller goals like getting documents, ID, BC, SS, etc., or completing easier tasks is important to help clients feel like they are able to achieve things on their own again, and also to help them build the needed skills to achieve long-term goals. From Vicky, ideally, we would end all homelessness. If funding tied to successfully meeting goals, smaller targeted populations may be more achievable. And realize that putting a homeless person in housing is not always the correct way to end homelessness. Wraparound services need to be in place to help the newly housed succeed. I agree the goals should be universal. Subpopulation specific goals should be implemented due to different reasons for homelessness. Subpopulation target dates should be tailored to local communities with specific goals for marginalized. Pretty resounding support of subpopulations there.
That's great. Okay, let's go to the next question, number 6. And this is our final question, really to open it up to the group. Is there anything else you wish to add? Any questions I didn't ask that you want to respond to, or anything that you feel like you wanted to say and haven't yet? So just opening it up.
Yeah, we still have plenty of time, Katie, so we're good on time. In the future, will there be a cap on the price of rentals in the state? I guess in the future, do you think there will be a cap on the price of rentals in the state?
That would be a local decision.
Yeah.
Anything else? Anything else you want to share or ask? Any questions for me?
From Sam Church, we have a question. Any sense on if federal resources for homelessness will continue to be as high as they have been with the CARES and ARPA funds?
That's a great question because Build Back Better passed through the House today. So if funding goes through Congress, there is considerable amount of resources that will be dedicated to homelessness. So we are watching that carefully.
Okay. From Kim Coco, if there is a federal minimum wage, why not a federal rent control?
That's a good question.
From Nicole, it feels like programs and goals are often set by those who are not specializing in social services, but rather budget and financial people. It is imperative that we listen and allow those of social services to take the lead and offer input that is valued. And I think I would say the same with folks with lived experience.
Absolutely.
Being part of that discussion.
And that is a big reason why we're doing these listening sessions. This is, we probably, between now and the end of the month, we will have done 80 or more listening sessions around the country. And we have over 1,000 entries into our online portal of people who've given us input. So it's just been a great opportunity to hear from communities. So absolutely.
Yeah, and Katie even listened, had a listening session with our Oahu Youth Advisory Board. So that was great to include their voices as well.
Yes.
From McKenna, the root of homelessness is the broken systems in place.
Yeah.
From Jessica, can we cover Section 8 program for possible home ownership? From Eilena, would the feds consider to donate or lease back land to the city or state for more housing on Oahu?
I'll answer that. There is land through federal land opportunities, and when those opportunities, when the federal government makes that land and or properties available, the state is notified.
Right. All right. I have 2 jobs and make a decent living. However, the rental situation could make me homeless. So imagine what our vulnerable people go through. Yeah. We could use support from the federal government because local and state laws are not cutting it. Example, state prisons account for 57% of mass incarceration. 74% of people in local jails are not convicted of a crime, and criminalization strongly connected to homelessness. And then from Deborah, although many thought that subpopulation goals were more important, I feel that a base universal goal added to the local goals would bring more accountability and impact.
And I'll add that the person who said the issue around resistant, or service, the broken system and the issue of resistant services. I was in a listening session recently and I heard the most beautiful quote from a woman experiencing homelessness. And she said, we often hear that people are service resistant, but she said, I would actually say that the services are resistant to the people. And so I think it's really important to think about how we set up our systems that actually help people move through rather than create more barriers.
All right, from Betty Lou, root is how to create housing for the very low income and mix it within other income groups. More community diversity is essential. Also, in housing for homeless and others, build in ways to promote community building. You need to create communities and neighborhoods, not just building housing projects. All right, a big barrier to accessing housing and services is the lack of vital documents. Many houseless individuals lose those docs when there are street sweeps or they get incarcerated. We need a system in place for houseless to store their vital docs and a system for the local jail to store docs in a similar fashion. And then from George, can federal reduce spending on military and invest into social services? The government spends around $718 billion. I'm assuming on military, we can use 30% of that to build communities.
Great,
Got some agreement on that.
Yeah, let's go to the next slide.
Okay.
And this is really important because this is not your only opportunity to give us feedback. The feedback you've given us today is so incredible, and I really appreciate your time. You can give additional feedback if you think of anything after today that you wanted to say, or if you want to share this link with your network, especially with people that you serve that are experiencing homelessness, if they have the opportunity to share their thoughts. This online survey is the same set of questions, and it's very easy. If you click on this link, you can fill in the questions again, or share additional thoughts. So please feel free to give us additional input. This will be open through the end of November.
There's friendships popping up on the chat. In a capitalist society, there's no profit motivation to abolish homelessness. Programs do not address the most in need of services who do not have documents on hand.
Great, next slide. So I just wanted to share with you our timeline. As I mentioned, we're on a fairly aggressive timeline to create a new federal plan. We're collecting input through the end of November, and then we'll begin drafting the plan. And our hope is to have it released by the end of May. And so we go through a federal clearance process with all of the federal agencies, and our hope is that this new plan will be out by the end of May. Next slide. Any questions for me? Any last questions?
Oh, and just a correction for Nicole's comment. She was talking about 90-day programs do not address the most in need of services who do not have documents on hand. Yeah, thank you. So Katie, people should be sharing that link to other folks who may not be on our session today, and open it up to any groups that may be interested in voicing their ideas and suggestions on planning for the USICH. Oh, you're muted, Katie.
Sorry. Go to the next slide. This is our website, and if you are not familiar with our website, we have a tremendous amount of resources on the website. We also put out a newsletter every 2 weeks, and when you go to the website, it will prompt you to sign up for our newsletter, and I really encourage you to do that. This is the way that we get out information to communities. There is a lot happening at the federal level. The question around federal resources, through all the federal agencies, will be sharing that, as well as tools for communities. And so encourage you to follow us and to visit our website. Also, I'll put in the chat my email address as your regional coordinator. Please reach out to me if I can be helpful to you. I work very closely with Laura, and then also folks at the city and counties, and at the state. So please, please use me as a resource if I can be helpful to you in the future. And I just want to thank you so much for your time today. This was great.
All right, we've got a question for you. We've got a few more minutes. So are you seeing more of a progressive approach in the federal government to the homeless crisis recently? We see the results in funding programs to get people off the street, but is there actually movement to push for more funding and programs?
Yes. This administration is very interested in addressing homelessness. So we are seeing, I mean, I think it will see, because it's still new in the administration, but we are seeing a lot of involvement in this work at the highest level, and in a lot of interest in creating programs that, again, help people move out of homelessness. I'll also say that yesterday I was part of probably one of the first ever federal interagency working groups on mainstream upstream prevention, really looking deeply at what is causing people to fall into homelessness. And that is really exciting. In the past, as a federal agency, we've been resistant to focus on mainstream upstream prevention because we feared that we would divert resources or attention off of people who are literally experiencing homelessness. And what has been declared is that we have to do both at the same time. The numbers of people coming into homelessness is higher than the numbers of people exiting homelessness. And so we have to do that work at the same time. And so we, as a federal agency, among our federal agencies, are really looking carefully at ways that we can identify the risk factors that cause people to lose their housing and figure out through those systems of care how people are entering the homeless system, whether it's child welfare or the justice system and things like that. And so that is some work that is underway as well. And I would say it hasn't happened in other administrations. And so we're super excited that there's this leadership right now to do this work. It's very hard work, as you know.
That's absolutely wonderful to hear. Thank you, Katie. Any other comments that anybody would like to bring up or questions? From Deborah, I work for a shelter that provides rental assistance, and there are several families who are qualified for assistance and are self-sustaining for the rentals. However, there is a shortage of rentals available. If these families are not housed, that they are potential candidates for homelessness.
Sure. I'm hearing that all over the country, just the lack of housing stock, not only just affordable housing, but just housing stock in general.
Yeah, Deborah, we've been with our landlord engagement program, we've still been able to find landlords, but it is getting harder and harder, especially for those with any kind of a criminal history or evictions in the past. From Eilina, we really appreciate you, Katie, for asking everyone for their thoughts and honoring our feelings, opinions, and statements.
Absolutely.
And from Betty Lou, definitely need focus on identifying how to prevent people from falling into housing, but isn't this really often an affordable housing issue, truly affordable? Yep, I'd agree with that. All right, I think, Katie, I'd like to thank you for sharing all of your great leadership and helping us out here in Hawaii. Like Katie said, she knows Hawaii very well, and she participates in many different ways for several years now. So she's a great representative for our islands, and we appreciate it. I'm going to go ahead and stop sharing.
Thanks, Laura. I really appreciate you inviting me to participate today. And I also so much, there were such great comments in the chat. Before you all close Zoom, can you get me a copy of the chat so I can have that documented? That'd be great.
Yep,
Thank you
we
all
will
for
do
your time.
that. All right, so thank you, Katie, and I will just finish up here. Just wanted to thank all of you for participating. We still have several hundred people on the line, so thank you very much. So I just wanted to take this opportunity to give out some thanks. We really wanted to thank our sponsors for this year's conference. Despite us not being able to have an in-person conference, we still needed sponsorship to allow us to bring this presentation to you. And so I'd like to start off with thanking Aloha Care, United Healthcare, Ohana Health Plan, the Hawaii Interagency Council on Homelessness, as well as the Governor's Coordinator on Homelessness, Alternative Structures International, Project Vision Hawaii, the Executive Office on Learning, U.S. Vets, and Steadfast Housing Development Corporation. Thank you all for being great sponsors. And we would also like to thank our partners at HUD, both at the local level with Mark, Stephanie, Brian, Ramona, Rebecca. Oh, and there's a new individual there. And with our city partners, with Anton and Eilena and Daryl Young, Tim Ho and their groups, as well as the state with Scott Morishige and the Governor's Coordinator on Homelessness Office, along with Cheryl and Emma, Jonah, or actually Jonah's now at HCRC, and your whole team and your students who have been a great help to us. Thank you all for being great partners with us through this very difficult time. We would like to request that people fill out an evaluation to help us bring different speakers to our islands or bring speakers from within our islands who have expertise, as you could see throughout today. We had a lot of excellent speakers that are from our own organizations. So please fill out an evaluation. And if you want to receive CEU credit for any of today's sessions, you will need to fill out an evaluation. And lastly, I'd like to thank the Awareness Committee for their great work over the last year, basically, putting this together and being able to pivot once again to a virtual setting to allow all of our attendees to attend statewide. And hopefully next year we will be able to see all of you in person. And I'd like to call out our committee, especially our committee chair, Jerry Kalima. Thank you so much for all the work that you've put into this conference, along with Danny, Rhea, Keala, Summer, Miley, Oli, Sherilyn, Cheryl, Jason, Kyla, Berta, and Sharon. And with that, I'd like to thank you all for participating today. I hope you all have a wonderful Thanksgiving. You know, this is Homeless Awareness Week, and I appreciate all the work that you do with our individuals who are experiencing homelessness. And I thank you for putting so much effort and love into all that you do. So with that, have a wonderful evening and take care.